Hi, I'm Dr. Mike Overton, University of Georgia College of Veterinary Medicine, and with me is Dr. Carlos Simmons. Alta has created a specially designed training DVD concerning calving and maternity management to help your herd improve its reproductive performance, to help you improve your labor training and efficiency, and help improve the overall productivity and profitability of your herd. Alta's goal is to make every pregnancy count for you.
The ability of a cow to successfully conceive and give birth each year is essential to the profitability in a dairy operation. Increased treatment costs, deaths, and disease in calves reduce productivity and reproductive efficiency in the dams and will directly impact the bottom line of a business where the primary revenue source is milk production and cattle sales. On the dairy farm, calving processes and calf management are sometimes undervalued as areas of importance. Next, the Alta team will show you the correct procedures on calving assistance and newborn calf care, which will help to reduce patrician problems through good management practices. The maternity pen. The calving area is recommended to be located directly adjacent to the pre-fresh pen for ease of cow movement and to be appropriately sized. They should not be in a heavy traffic area where the cows might be easily disturbed. It should be a well-bedded area with a feed area close by. Water troughs should not be located on the bedded area, so bedding remains dry. A warm, dry, and well-lighted environment goes a long way to encourage the use of proper techniques in calving management. It has also been shown that both cow and calves that experience calving difficulty recover faster in a comfortable transition area. The lockup for the cow should be near the bedded area, with sufficient room available behind the cow to deliver the calf. For the calf, dam, and the people assisting the delivery, protection from the elements and personal safety is desired. The post-delivery area should be protected to keep the calf warm and dry. Removal of the calf from the dam as soon as possible will decrease the calf's exposure to disease-causing organisms from the dam. This area also needs to be easy to clean. The reproductive anatomy of the cow. The female reproductive organs consist of vulva. It is the external opening of the vagina. Vagina. It connects the cervix with the vulva. It is approximately 8 to 10 inches in length. Cervix. It plays a key role during the calving process. It is located between the vagina and the body of the uterus. It is approximately 2 to 5 inches in length and 2 inches in diameter. Body of the uterus. It is located anterior to the cervix. It is made up of soft tissue and is usually 1 inch long. Uterine horns. Each one is approximately 8 to 16 inches in length and are connected to their respective oviducts. Oviducts. They are the tubes that connect the ovaries with the uterine horns. Their function is to provide the site of encounter and fertilization between the ovum and the sperm. Ovaries. They are approximately 1.5 inches in length, 1 inch in width, and 1/2 inch in thickness. And their main function is to produce eggs and to secrete the hormones estrogen and progesterone. Normal patrician. Normal patrician is a continuous process in which a mature fetus or fetuses are expelled from the uterus to the outside in order to begin a new productive life. There are 3 important words in the calving process: observation, patience, lubrication. The stages of calving are divided into 3 phases. Phase 1. uterine contractions, and cervix dilation. This stage lasts from 2 to 16 hours and generally takes longer with heifers. It begins with the contraction of the uterine muscles and ends with the complete dilation of the cervix. During pregnancy, the cervix is filled with a mucus secretion known as the cervical plug, which protects the uterus from infections entering from the vagina. The cervical plug is expelled and the cervical opening begins to dilate in days prior to calving. There is a relaxation of the ligaments around the vulva, swelling of the vulva and udder. As the fetus enters the birth canal, the cow shows signs of discomfort, becomes restless due to the initial contractions, and tries to separate from the rest of the herd. The cow urinates frequently, and the presence of bloody mucus discharge and sometimes the water sac can be seen. Phase 2. Straining and the expulsion of the calf. This phase may last from half an hour to 4 hours. Once the calf has entered the birth canal, the calf's feet and nose should be visualized through the vulva. Contractions will increase, and the oxytocin is continuously released until the expulsion of the calf. Interrupting the calving process may prolong the patrician, compromising the life of the calf. Phase 3. Expulsion of the placenta. This phase lasts from 1 to 12 hours after calving. This phase ends with the expulsion of the fetal membranes, known as the placenta. Equipment for assisted calving. All the equipment must be clean and disinfected before and after each intervention. These are the equipment and supplies required when assisting a calving: obstetrical chains, chain handles, disinfectant, lubricant, disposable plastic sleeves, soap, clean bucket with warm, clean water, clean and dry towels. These are to assist the newborn calf. Head restrainer, calf jack. It is useful when used correctly. Presentation, position, posture. In order to have a normal delivery, it is very important to know the position of the calf in the birth canal at the time of patrician. Presentation. Presentation refers to which direction the calf's head is facing. There are two normal presentations. Anterior, when the calf comes forward with both legs and head into the birth canal. The soles of the front feet are pointing down. Posterior, when the calf comes backwards with the rear legs into the birth canal. In a backwards delivery, the soles of the feet are up. This presentation is high risk because of the possibility of the umbilical cord being pinched against the pelvic bones, triggering the calf to breathe prematurely, inhaling fetal fluids causing the death of the calf. Position. Position refers to the relation between the calf's back and the cow's spine. There are two positions. Dorsal. When the calf's back is up towards the cow's back. This is the only physiological position that is considered normal. Ventral. When the calf's back is down in the pelvis, the calf is upside down. Posture. Posture refers to the position of the calf's head and limbs in relation to its body. How to know when it is the right time for intervention. The person in charge of the maternity area must be trained and be able to make the correct decision based on the progress made by the cow. It is recommended to watch the cows every 1 to 2 hours in the first stage of calving. When the cow or heifer is in phase 2 of calving, the recommended frequency of observation is every 30 minutes. When to intervene. If you do not notice any progression during stage 2 After 4 hours, the cow or heifer should be examined to determine if there is a problem. If the water sac has been visible for more than 2 hours without any further progress. If the calving process is interrupted for more than half an hour. If the cow or calf is showing signs of fatigue, the calf has a swollen tongue, or meconium is present. If at the palpation exam you suspect an abnormal presentation in the birth canal. Forced extraction. For the safety of the cow and the operator, the cow must be restrained in a space large enough to allow the operator to work and to allow the cow to lay down if necessary. Remember, the person assisting the calving should maintain a good hygiene protocol during the process. The vulvar and perineal areas need to be cleaned and disinfected periodically, and the use of lubricant is highly recommended. Obstetric palpation. Once you have made the decision to pull the calf, you should perform the obstetric palpation to see if the birth canal is fully dilated. Do not pull the calf if the cervix is not totally dilated. Assure that the calf is alive by checking for withdrawal reflex, suckle reflex, rectal reflex, and heartbeat. Determine the position of the calf. Remember, ask for help. If you do not know how to correct or are incapable of solving the problem, or you have been working for 30 minutes and have yet to make progress, seek assistance from somebody who has experience or call your veterinarian to help the cow and the calf during this process. Before you begin pulling the calf, you need to be sure that the calf is in a normal position in the birth canal. If the calf is in an abnormal position, you must correct this first before you start pulling. Once you are sure that the calf is in the right position, place the obstetrical chains in a double half hitch where the first loop is placed above and the second one below the dew claws. This will assure an equal distribution of pressure and will reduce the chance of any damage to the calf's feet. Never place the chains on the sides of the limbs. Obstetrical chain pulling procedure. Anterior presentation. Once the obstetrical chains have been placed correctly, the operator should apply traction to one leg at a time to allow the shoulders of the calf to pass the cow's pelvis. This action avoids the elbows of the calf from locking up against the pelvic area of the cow. Apply traction steadily, alternating the pull from one leg to another. Knowing when and how to use the calf puller is important. Proper placement of the calf jack on the cow's rump is key to avoid any damage to the cow. When pulling the calf, the birth canal and the vulva should be dilated. Use your hands and forearms to facilitate the passage of the calf through the birth canal and to prevent external damage to the vulva. In the case of an oversized calf, it is recommended to rotate the calf when entering the cow's pelvis, so the widest part of the calf's pelvis can pass through the widest area of the cow's pelvis. It is important to remember that the umbilical cord is compressed and the calf begins to breathe on its own, and the delivery is permitted in most cases. Posterior position. It is recommended to first rotate the calf 45 to 90 degrees to take advantage of the widest point of the cow's pelvis. This extraction should be performed quickly because compression of the umbilical cord triggers the calf to breathe prematurely, causing fetal fluids to enter the calf, resulting in drowning and death. Correction of abnormal presentations. Elbow lock posture is when one or both of the forelimbs are not extended into the pelvic inlet. This abnormality is corrected by pushing the calf back into the uterus, while simultaneous traction is exerted on the affected limb. deviation of the head. If you cannot feel the head, do not assume that the calf is coming backwards. The front legs may be present and the head deviated to the sides or down between the legs. In this case, you should correct the abnormality using your right hand if the head is bent back to the left, and vice versa. By grasping the muzzle or by placing the thumb and middle finger into the eye sockets, the head can be raised and directed into the pelvis. A head restrainer or chain should be placed in the mouth and looped up around the head behind the ears. Looping the chain around the lower jaw could fracture it. This procedure should be avoided unless necessary. Forelegs retained. In this situation, the head of the calf may be out, but one or both forelegs retained. You need to secure the head by placing the chain or head restrainer behind the pole and through the mouth. Then lubricate the head and push it back into the uterus. At this time, you can start searching for the limbs one at a time. If the limb is fully retained, it should be grasped just below the knee and pulled until bent at the knee. Then you can slip a hand down and grasp the limb. It is recommended to cup the hoof to protect the uterus. Posterior presentation. Breech posture. You may not see anything through the vulva. You will only feel the tail. The correction of this abnormality is similar to the forelegs. First, you need to find the hock and pull it until it is in the flex position. Then, slip your hand down to cup the hoof. The hock is now repelled by one hand in a forward upper direction, and traction of the hoof is applied in a medial backward direction by the other hand. Upside down position. This abnormality could be found in either the frontward or backward position. Each forelimb should be carefully pulled into the birth canal. You need to cross the limbs of the calf, one on top of the other, and try to rotate the calf and the head of the calf at the same time. Each forelimb should be secured with a chain and carefully pulled into the birth canal. Transverse position. This is a difficult position to correct and may require a C-section to deliver the calf. Postpartum care of the calf. Assisting the calf immediately after birth is important. Make sure the calf's mouth and nose are free of mucus. Primary attention is directed towards establishing respiration. Place the calf's chest against the ground and extend its limbs. Tickling the calf's nose with a piece of straw will help the calf to breathe. Do not hang the calf upside down. The weight of the intestines on the chest makes expansion of the lungs difficult, preventing fluids in the lower respiratory system from coming out. It is more important to help the calf breathe vigorously. Treat the navel with an iodine solution. The belly area, including the umbilical cord, should be dipped in an iodine solution or other approved disinfectants. The solution will dry and prevent pathogens from entering the calf's body through the cord. Use clean towels to rub and dry the calf's body. This procedure helps to stimulate the respiratory and circulatory systems. Help the calf to stand to encourage walking. Make sure the calf gets quality colostrum within the first 2 hours after birth and a second feeding 6 to 8 hours later, for a total of 1 gallon. Colostrum is rich in proteins and immunoglobulins, or IGs, which are indispensable to protect the calf. Calves and testines have the ability to absorb IGs within the first 2 hours after birth. For approximately 4 to 6 weeks after birth, calves depend on the IGs absorbed from colostrum to protect them from infectious agents in their environment. If not fed immediately, colostrum should be refrigerated or frozen to preserve the IGs for later use. Remember, good hygiene in a clean, warm, and dry environment are key for calf survival. Postpartum care of the cow. The cow should be palpated after birth to check for twins. Monitor for a retained placenta. The placenta should be expelled from 6 to 12 hours after calving. For metabolic disorders, such as milk fever, talk to your veterinarian for treatment protocol.
I'm Chet Rawson, veterinarian. I work currently as a field fertility specialist for Alta Genetics.